Welcome back. If you're joining us, you're watching Channel 1 News Hour. Before, of course, we begin our interactive segment, our focus of discussion this evening on cancer. Let's first take a look at what really are we dealing with when we talk about cancer and look at some of the people who are living with cancer as they tell their story. Now, cancer has been categorized as one of the leading high-cost diseases, not only in Kenya, but in the world. Now, affected families have been drained of their finances by cancer through treatment. Now, the National Cancer Institute puts the cost of treatment as high as 2.5 million Kenya shillings. Now, Rose Adero, a cancer survivor, speaks to our reporter Betty Kiptum on how the disease not only ate all the family's savings, but also left her as a widow.
Rose and her husband had a dream of a very happy family after they came together as man and wife in 1992. Little did they know 23 years later, their lives would change for worse. It all began in 2015 when her then workplace was offering free cancer screening, which she happily participated. Her results broke her heart.
Nilipatikana na cancer stage 1, 2015, stage 1B1.
She then began her treatment process using the little she had saved, coupled with an injection here and there from the National Hospital Insurance Fund.
Nikafanyiwa operation, nikaenda chemotherapy, radiotherapy, nikaendelea na matibabu.
In December 2016, her husband started feeling chest pains. When he went for tests, doctors told him he had a growth on his chest and recommended a biopsy test. The results were heartbreaking. He had lung cancer stage 4.
Patikana yuko na lung cancer na tulitembea Kenyatta more than 3 months kabla aanziwe treatment. By the time alikuwa anaanziwa treatment, tukaambiwa cancer yake imespread na imefika stage 4.
At this time, Rose had taken a break from her treatment to concentrate her time and finances on her husband's recovery. They lost their jobs, and to add salt to injury, ran dry of finances. In October 2017, his situation got worse, and when they returned to Kenyatta National Hospital, were asked to get a doctor's written assurance that they would pay after the procedure. The NHIF fund could now only cater for a CT scan. The morning that she managed to get the letter, the worst happened.
Siku yenye nilipeleka hiyo barua, the following day, mzee wangu akawa ameaga.
The treatment and death of her husband drained all the family finances. Rose has not gone for treatment since 2016.
Siendi hospitali kwa sababu sina venye ninaweza nikaenda hospitali hata kwa sasa venye nakwambia. Nilikuwa na watoto wawili walikuwa college, ilibidi wasiendelee. Niko na mwingine pia amefanya mtihani last year form 4 na amepita. Hata sijui ataenda shule aje.
She says she was shunned by family and friends as the society thinks a cancer diagnosis is not only expensive due to high cost of treatment, but also a death sentence. For Channel 1 News, I'm Betty Kiptum.
Well, the story by Rose Adero tells the story of very many Kenyans who are actually living with cancer. And of course, this discussion just coming after the celebration of the International Childhood Cancer Day, which was marked on Saturday. And we're just trying to look at what really are we doing as a country? What is the situation? What are the statistics? Putting faces behind the numbers and asking the government, what really can we do for persons who are living with cancer? And for more insight on that, now joining me in studio is Jane Francis, who is the Secretary General for the Cancer Survivors Association of Kenya and is also a cancer survivor. Jane, it's good to have you this evening.
Thank you.
Let's just, look at the story of Rose. You also have your story. Let's begin from your story. Your battle with cancer. Where did it all begin for you?
Yeah. For me, it was in 2013, and I started itching on my left side. And I went to quite a number of hospitals. I had actually 2 insurances, but after going to around almost all the hospitals, they didn't discover the reason for the itching. Until in 2014 I had to cut short my PhD studies. I was studying in Jomo Kenyatta and I was also lecturing when it became too much.
Yes.
And then I started having a sensation in the left breast. So I went and I did an ultrasound and I was found with a very big tumor of 9 centimeters. but it was under the breast. Yes.
So what happened after that?
So, of course, after that, first, of course, there is a shock that you get, because I had known several people, especially relatives, who had passed from cancer. I just lost my father the year before, and grandparents actually to cancer. So it was a bit scary, because I knew of the financial implications, the financial burden, and also the psychological trauma. But I had to go around different hospitals trying to get the most reasonable. Of course, the one that I found, and the only one as at that time that was most reasonable, was Kenyatta National Hospital.
Yes.
But for example, I was told I had to wait like 3 months for surgery, and then I was to wait for 2 years for radiotherapy. That was 2014 and 2016.
So there was a queue already before
Very long queue.
Uh-huh.
Yeah, so finally I just had to finally go to Aga Khan Hospital. And of course, you know, that's one of the most expensive. As at that time, NHIF was not covering. So I had just to sell a few properties and so forth. And together with support also from Aga Khan, pay what I could, and they helped me with the difference. Because also the type of cancer I was discovered with is a rare one. It's called triple negative breast cancer.
Yes.
So I have to do chemo, surgery, and radio very quickly. Otherwise, it was in stage 3B. It would have spread. I had been told if I didn't start chemo in 2 weeks, it was going to spread to stage 4, which can be in the lungs or liver or brain. Yeah, so I had to move very fast.
Have you since been declared cancer-free, or are you still on treatment?
Well, when you say cancer-free, in faith, I can say, because I'm walking and I'm here.
Yes, you talk about
Yes,
stage 3.
yes, and I was talking about stage 3B
Yes.
then. That's quite many. The doctors or the hospital can only talk about disease-free as at the end of your treatment.
Yes.
Anything after that, after every 2-3 months, cancer is an abnormal multiplication of cells. And I'm the same Jane Francis, I'm the same with DNA. So anything can happen and the cells continue multiplying. So I have to keep monitoring. So after every 3 months, I have to do very many blood test scans and so forth. Once a year, I need to go to India and do what's called a PET MRI, which is not available here locally, to be able to check those cancer cells, especially when they are very small. For example, like last year, I did several tests here, several scans, MRI, and all were showing suspicious now on my right breast. So, and I have 3 tumors, and they're being rated as BRADs 2, BRAD 4, and 6. The 6 can be even not just in the breast, it could be anywhere else. Yeah, but now trying to go out, it's been very difficult. When we try to get letters, it hasn't been very easy from the doctors, and NHIF is also not paying for us outside the country.
Let's talk about,
Yes.
the accessibility of treatment.
Yes.
Because, of course, the government under the Big Four is talking about, affordable health care.
Yes.
But is it easy to access these services? Even before we talk about the cost,
Yes.
are there enough facilities that are offering treatment options for persons living with cancer?
Yes, the government has tried their best, let me say, so far. But I'm saying that I would say there is a lot that has to be done. And in fact, on Saturday, as we marked International Cancer Day,
Yes.
we as cancer survivors of Kenya launched a petition which we are hoping will reach the Honorable Sabina Chege, chairperson, very soon, and also the Dr. Michael, the chair for the Senate, and various other related ministries. And the reason is that we feel basically it's only KNH that we can say is offering affordable treatment. Because with that, and there is also nowadays MOI referral, with NHIF card, I think much could be covered. Of course, the queue is still there, because everybody is coming, and not just from Kenya, even from the neighboring countries, most come to Kenya. So most of the other county offices, I doubt if they have like chemotherapy, radiotherapy. I believe there is only 2 or 3 radiotherapy machines in the country. So that's KNH, Nairobi, and Aga Khan. So how can we talk about affordable when we have only 3 machines?
So access still remains a major challenge.
A
as we
major
speak.
challenge.
So you've said you've launched a petition.
Yes.
What is it that you want captured in that
Yes.
petition? What is it that you want the
we have quite
government
a
to do
number of
differently?
points. There are more than 15, but I will summarize.
Just highlight a few,
mainly,
yes.
especially the fact that the country, the president needs not just to declare it a national disaster, but actually put different measures that ensures that it is also treated as such that different hospitals in the counties, the major ones at least, the provincial hospitals, are equipped with the necessary machines. This radiotherapy we are talking about, but even before that, even the detection machines. Most people, you go there, you have a lump or what, it's just removed, and they don't even think it could be cancer. And you go home, and after 2-3 months, this person has died. It is only that it was not properly diagnosed. So we need all these different diagnostic machines installed in those places so people don't have to come to Nairobi. And at the same time, we request that NHIF is able to cover all this. Most of us, after, as I told you, 3 months, 6 months, even those of us who are survivors, we have to continue monitoring. And all these scans, most of them are not covered fully by NHIF, partially in maybe the hospitals like KNH. But if you go privately, in many of them, sometimes it's not covered. So the burden still also remains. So at the same time, we also request that NHIF reduces the bureaucracy in getting permission to be treated. You are told you have to wait maybe 48 hours, I don't know. And sometimes it's an emergency, especially when the cancer is stage 4. If you don't do this, you know, and it will spread and to different parts of the body. So those are main highlights. We also would like that the government, there are different bills being passed, there are different funds being set up, like the Kenya Cancer Fund that is being pushed by Honorable Waruguru. Are the cancer survivors, for example, in these bills? There has been a lot of movement up and down the country under the universal health care, and none of us are ever asked, what's your feeling, what's your expectation? And those of us who have gone through it know much better than somebody who is just trying to come up with a document. So we request also that cancer survivors are recognized in the decision making of the healthcare situation in Kenya. And in particular that many of us, some of us at least, are appointed to the several boards which are already in existence, so that we can also give our input. And then at the same time, would like that cancer patients be considered in the Disability Act. Many of us, like some have no legs, most of us have lost, for example, the breast, 1 or 2. We usually have a condition
so
like
you want to be incorporated into that?
Disability, so that you have tax exemption, and then you can use some of the money for management of the cancer, because it's not just that 3 months of radio and chemo or 1 year. It's a long-term management. Yes, and very expensive.
Based on the different initiatives that we see happening, we are seeing county governments setting up, cancer centers. But in terms of, are we spreading, like sort of bringing in too many organizations at the same time, and in the process we are losing focus in how we really want to manage cancer? Should it be centralized?
Well, now that the country has decided to devolve to 47 counties, we should look at the positive aspect of the devolution, inclusive also in the healthcare. Of course, at the national level, especially like now that they are budgeting, that should be really considered, so that every county has enough to be able to set up their own cancer centers. But I think it is much better if it is devolved, even if not in every county. But as it was before, we used to talk about 8 provinces. So we have major hospitals. We have in Nyeri Provincial Hospital.
But do they have the facilities and the personnel to be able to run these hospitals? That's what they don't have. And therefore, one of the other petitions that we have is that the medics, quite a number of them, should be encouraged to study oncology and all those related cancer issues, so that, and not just locally, most of them, they have to go out, because cancer is very evolving very fast. So it's not enough just to study here. Quite a number of them must go to study outside. I've been to India and I've seen even many doctors from Tanzania being trained in India, even if they don't have to go to US or Germany. They can make partnership. I've seen the Prime Minister of India coming. These are some of the opportunities we should take. Quite a number of them should also engage in research, the doctors that is, so that they can also find out medication that is even reasonable to cancer patients, because much of it is very expensive. And after the diagnosis, some people have to be on 5-year treatment and then 10-year, and some is very expensive. The other day I was in one of these hospitals, and one patient came and wanted this month, which they have to take daily, and they wouldn't give her on the NHIF cover. Why? Because it's less than 1,000. So you also want the NHIF to fully cover every aspect of cancer.
Ones. They did it for HIV. They mainstreamed it. Today, cancer, HIV patients, most of them are surviving comfortably. Why is it difficult to do for cancer?
So you want the same to be done?
Yes.
You mentioned that you have been trying, to get authorization to go to India.
Yes.
That brings us back to the question of why is it that it's not possible for you to get that authorization?
Because the doctors do not want the patients to go. The reason where I hear many patients saying is that we are able to treat cancer. You may be able to treat cancer, yes, but how many doctors do we have? What is the ratio of the cancer doctors and the patients. There are too many. There are too many. And then, as I said before, it's also very expensive here. So if somebody can be able to have the family members and friends fundraise for them, and they can access the treatment quickly, as I've just said, if it is advanced stage 3 and 4, you cannot delay and, you know, waiting for the most reasonable. So I think the doctors need to be quite fair and and accept the fact that yes, they are there, but they are also quite few in relation to the diseases, because it is quite rampant now.
All right.
Yes.
I'm told our time is up, but I just want you to
Yes.
look into that camera and
Yes.
perhaps speak to, you know, the government as regards what you really want them to do for cancer patients.
Yes.
Yeah, as we wrap up the show, and perhaps just give, you know, hope to those who are battling cancer right now.
Okay.
Your camera is right here.
Okay.
Yes.
So I just want to request the government, please do not just declare a national disaster, but do please ensure that every county government has enough resources, has enough finances to be able to take care of all the patients. Do also declare that every county should hold campaigns countrywide so that people can be told of the various risk factors and they can try to prevent. And for those of our patients who are trying to struggle with the cancer burden, do not worry, just be strong, be positive, and do exactly what the doctor tells you. Take the necessary medication, and of course, remember always our God, because He's the one that finally is our creator, and He knows every cell of our being. And if you trust in Him, He will definitely heal you. Thank you.
Well, thank you, Jane. Of course, we'll be having you back to discuss more about, you know, your petition and what it is that you've been able to achieve. But all the best as you try, you know, to get people to listen to what you have to say and to take cognizance of the issues that you're raising as persons who are survivors of cancer.
Thank you.
Well, it's time for us to wrap up Your Health segment. That, of course, is Jane Francis, who is a cancer survivor and the secretary of the Cancer Survivors Association of Kenya, just shedding light on what are some of the issues that they want the government to address. They have since removed a petition that they will be taking to Parliament and just seeking to have the government declare cancer a national disaster.